Today's topic is anatomy and subtopic is neuroanatomy. Meanings, see the meanings and dura mater, arachnoid, pia mater. Fox cerebri contains state sinus. Dura is supplied by all cranial nerves except fourth cranial nerve. Diencephalon represents third ventricle. Forebrain prosencephalon. See the pictures. This is forebrain. It consists of telencephalon, which forms cerebral hemispheres, and diencephalon, which forms optic cup and stalk, pituitary thalamus, hypothalamus, and epiphysis. Diencephalon, it develops from median portion of prosencephalons and consists of a roof plate and two alar plates but lack floor and basal plates. See the pictures. Roof, optic vesicles, myencephalon, telecephalon, diencephalon. The lunate sulcus is an example of operculated sulcus. Broca's area is present in inferior frontal area. Subfrontal gyrus, subparietal lobule, subtemporal gyrus, anterior central gyrus, post-centropal gyrus. White matter. This is the part of brain cross section. Gray matter, white matter, ventricles. Corticonuclear tract is carried by genu of internal capsule. Corpus callosum is an example of commissural fibers. Diencephalon. See the picture. Diencephalon, thalamus, hypothalamus, pineal gland, brainstem, midbrain, pons, medulla oblongata, cerebellum, spinal cord, pituitary gland, cerebrum. Corpus callosum is an example of commissural fibers. Optic tract is related to lateral geniculate body. Brainstem, picture of brainstem. It is thalamus, midbrain, pons, medulla, spinal cord, and this whole makes brainstem. Olive is seen in medulla. Nucleus fasciculata is seen in medulla. Interpeduncular fossa contains mammillary body, posterior perforated substance, and oculomotor nerve. Cerebellum, and brainstem. Cerebellar connection to other parts of the brain is projected through deep cerebellar nuclei. Pontocerebellar pathway is transmitted by middle cerebellar peduncle. Blood supply of brain. See the picture. Ophthalmic, anterior cerebral, middle cerebral, posterior cerebral, superior cerebral, basilar, vertebral, internal carotid, common carotid, external carotid. Vertebral arteries, posterior circulation, and carotid artery, internal brain and external face. Chief artery of lateral surface of cerebral hemisphere is middle cerebral artery. Visual area of cortex is supplied by posterior cerebral artery. Venous drainage of brain. See the picture. The main drainage of brain is via superior sagittal sinus and the inferior sagittal sinus. These then form the two transverse sinuses which travel laterally and inferiorly to form the sigmoid sinuses. The sigmoid sinuses then form the jugular veins and descend through the neck into the superior vena cava. The superior sagittal sinus runs across the top of the skull in the middle, while the inferior sagittal sinus runs through the middle of the brain between the two hemispheres. Great cerebral vein is formed by fusion of two internal cerebral veins. Superior cerebral vein drains into superior sagittal sinus. The great vein of the Galen drains into straight sinus. Ventricles of brain. This is the brain, lateral ventricle, interventricular foramen, third ventricle, cerebral aqueduct, fourth ventricle, central canal. Pineal gland forms posterior wall of third ventricle. Facial colliculus is seen in pons. Other important parts of brain. Lumen insulae lies immediately lateral to anterior perforating substance. Gyri brevis, sulcus circularis insulae, Lyman insulae, gyrus longus, sulcus centralis insulae. This is cortex and this is lateral ventricular choroid plexus. This is third ventricular choroid plexus and this is fourth ventricular choroid plexus. This is spinal cord and this is cerebellum. Spinal cord. This is a picture of a spinal cord. We call it Manning's pia mater, pink layer. This is pink layer. This is purple layer. This is yellow layer. We call it pia mater, arachnoid mater, and dura mater. This is spinal cord, intervertebral disc, and this is spinal nerve. This is called vertebra. Subarachnoid space ends at S2. This is subarachnoid space. This is arachnoid. This is inner dura. This is outer dura. This is pia mater. And the spinal cord in infant ends at the level of L3. This is L3. The infant cord ends up to here. This is adult cord, subarachnoid space, filum terminate, sacral hiatus, extradural space, dura arachnoid, T12, L1, L2, L3, L4, L5, S1, S2, S3, S4, C1. Lateral spinothalamic tract is connected with pain and temperature. See the picture, spinal cord portion. Anterior spinothalamic tract, lateral spinothalamic tract. This is spinal nerve, receptor for pain, cold, warmth, crude touch, pressure, tickle or itch. First order neuron, posterior gray horn. Rubrospinal tract is an extrapyramidal tract. This is rubrospinal tract. See the pic very carefully. Parts are nominated here. Thank you. Subscribe my YouTube channel, Doctor Entrance Exam.